From the Daisy nominations received during the month of April, the winner is Dawn McAughan. You made me cry.
Wait, we have Kleenex just for this very reason.
And here's the nomination. Over the past 15 years, my husband, Douglas, has had many hospital stays at Trinity Mother Frances. As a chronic heart patient, his health has been serious. The nurses have always been wonderful and professional and have demonstrated true concern for him and our family. However, one nurse will forever stand out as remarkable. I'm sorry. On a recent stay in the cardiovascular intensive care unit, we turned the corner and saw Dawn. When she looked up, she immediately recognized us and said, "Principes," and came over for hugs just to check on Doug. A flood of memories came over me. 4 years ago, Douglas spent 14 days, on life support in very critical condition. He had wonderful doctors and nurses and top-notch care, but he also had Dawn. Over all that time, with 12-hour shifts, I never saw her sit down. She was constantly monitoring him, his many tubes and medications. Most amazing to me, she observed him so closely that even in his drug-induced coma, she could detect the slightest change in him and would act on whatever she observed. And when he swelled so large that it seemed impossible, she would manage to find clever ways to keep his skin from rubbing and breaking down. She was so professional, compassionate, strong, and positive. She would always try to make my visits, restricted at the time, meaningful for me, encouraging me to talk with him and helping me deal by answering my questions in an informative, calm way that allowed me to feel included in his care. Her manner went so far to help me deal with the facts of the situation and to avoid the terrible pitfalls that your imagination can play on you when you sit in an intensive care waiting room. I cannot express how important she was to both of us during those dark days. Through all these years and so much trauma, Douglas has continued to grow as a husband, father, grandfather, and friend. We attribute his positive attitude and good spirits in no small part to an attentive, kind, supportive, professional, friendly, and caring nurses of Trinity Mother Frances. He says they spoiled him, and they probably do a bit, but I thank God each day for them and their service to us and others. Please recognize Dawn for all she has done and continues to do. Shelley and Doug Principe. Now it is my pleasure, on the behalf of the Daisy Foundation, to proclaim you Dawn McAughan a Daisy Award Extraordinary Nurse. Here's your award certificate. And I'd like to read what it says. The Daisy Award for Extraordinary Nurses. This award is presented to Dawn McAughan, BSN, RN, in deep appreciation of all you do, who you are, and the incredibly meaningful difference you make in the lives of so many people. And the Daisy pin needs to be pinned, and this is Dawn's mother, Paula.
You're killing me. Thought they were just getting me lunch today. Surprise.
Looks good.
I'd also like you to be presented your sculpture, the Healer's Touch sculpture. Unfurl the banner. This banner is going to hang in the CVICU all month in your honor.
Only a dad can get away with that.
And the ever-popular parking pass.
Yeah.
Yes, parking pass.
I don't see where it is. They already gave it to you. Now a message from the Daisy Foundation. By definition, the Daisy Foundation thinks all nurses are extraordinary. and we wish we had the resources to honor all of you individually. Nurses who receive the Daisy Award often say, "Everyone in this unit deserves this award as much as I do, or I don't deserve this. I was just doing my job." What the Daisy nurse may not realize, however, is that when nurses are just doing their job, they have such an important and meaningful impact on the lives of so many people, many more than their patients. At every Daisy Award presentation, we ask each nurse to pause just for a minute and realize how very special they are and how they make the world a better place by just doing their job. Today, a nurse's job entails many things, but no matter what the day brings, a nurse's impact is invaluable and long-lasting to their patients and families. Thanks to your education and training, your commitment and judgment, your compassion and connection with your patients, you're very special. You make the world such a better place by just doing your job. The skill and compassion you bring to patient care makes a patient's outcome more positive or makes a family member feel a little better, so they are better able to help with the patient's healing. Please think about that every day you touch a patient. Story after story brings this to light. I would encourage you to look at the National Daisy website and read the stories. The link is on Nursing Public. Prior to our closing prayer, I want to give a special thanks to you, Shelley and Doug Principe, who nominated Dawn. This award does not happen unless you take the time to write the nomination, and it means a great deal that you care enough for Dawn to have done so. Thank you for choosing nursing as your career and as a skill. Care and compassion you give to your patients every day. And to Dawn, congratulations. And now before you head to the cinnamon rolls, Sister Irene from Pastoral Care is going to lead us in a closing prayer.